Sure.
So, good afternoon, everyone. Thank you for the opportunity. I know we are running late. I will not take a lot of your time. So, this is a child, 9-year-old, who came to Dr. A with the history of fall and had some amount of proptosis in the right eye. And it was just a 24-hour presentation. Doctor got his imaging done, and then they realized that it is not something that he can manage and need to be referred to the specialist. Then he went to Dr. B, and on examination there was a grade 1 RAPD 660 vision in the right eye, and he thought it's a hematoma and let's drain it, and it was drained. And on table this reversal of the proptosis was noted. Doctor patient both were happy. After 7 days, patient came back with the similar amount of proptosis. Dr. B got confused and thought, how come so much of blood and everything is again, and what is the lesion that is recurring so fast? So Dr. B referred the patient to Dr. C, and then the incision biopsy was done. Incision biopsy turned out to be nothing but alveolar rhabdomyosarcoma. So, and then later on, this chemotherapy, radiation, everything was given. Child was doing well for certain time. This is a old case when the child was doing well. Later on, the recurrence and everything happened, and child also developed a metastasis later post every treatment and could not survive. But this was a case which tells us that whenever this kind of a thing happens, or you see a case which could appear as just a subperiosteal hematoma or the trauma, you need to evaluate properly, as it has been given in literature that RMS can mask orbital trauma, and sometimes it appears almost the same, and patient doesn't come with the proptosis of RMS. Now the problem is CT scan finding. If you see of both the cases of RMS and subperiosteal hematoma, they are almost same. So it's very easy to get confused when you have such case scenarios. Only thing you can be very careful and try and see the shape of the lesions. Subperiosteal hematoma will try to maintain the convexity of the lower edge. RMS will try to take the shape of the eyeball and then start pushing the eyeball. MRI again, not much of a difference except if the injury is fresh. So uh, very important is do the history evaluation, like see the old pictures of the patient. And if the in the first case the blood which was drained out, even if that would have been sent to the pathology, some diagnosis could have been made in the first sitting. And of course, children with the proptosis, you always keep a high index of suspicion. Double imaging modality like CT hua hai, then why should I do MRI? Don't keep all this in mind. And if you think that you are not sure about the diagnosis, the extra imaging can be done. And when in doubt, and whatever lesion has been taken out from the specially orbit, it has to be sent for biopsy, even if you are very sure about the clinical diagnosis. I thank you, everyone.